Hello, I'm Alexander Mostovoy. I'm board certified clinical thermologist. And today I'd like to talk about an interesting subject, something that I have been researching for the past 12, maybe more years. And the subject is there a dental connection to breast disease? Maybe some of you have heard about us, but I bet you most of you probably have not. Now, before we begin, I just wanted to share an amazing dental work from thousands of years ago. And as you can see, even back then, what happens in a person's mouth became very, very important. When we look at the meridian tooth chart, in other words, acupuncture meridians, I'm sure that maybe the screen that you're looking at is very small, so let me just explain what you're looking at. Different organs connect to different via acupuncture meridians, or the meridian system in Chinese medicine, connect to different teeth. So for instance, if we're looking at right breast, these four teeth, premolars and molars, are going to be connected to that particular breast. Same thing on the left side, same thing on the bottom jaw as well. In this particular image, you can see the teeth are numbered and which ones are also connecting to different organs. So for instance, if we're looking at lower jaw incisors here, that would be connected to one's bladder, whereas the molars here may be connected to liver or spleen, and so on and so forth. Now, it has been published many years ago, actually in Romania, where they discovered that in 20 breast cancer patients compared with 8 benign breast lesions, everyone who had a positive or a malignant breast cancer, they found nickel, chromium, zinc, iron, mercury, and cadmium in the actual tumor. And all of these materials, as many of us know, are extensively used, and I should say uncritically used, in dental restorations. Infected teeth and breast cancer, there's not a lot of studies there, and I certainly encourage anyone who is interested to research these materials, as well as we definitely need more studies. But pathogens that happen to be in our gums and in our oral cavity, including a well-known pathogen called Fusobacterium, are significantly enriched in breast tissue from women with malignant disease. The same pathogen already has been strongly linked to other cancers, and many women who are chronically infected with teeth who have chronically infected teeth cause much of the breast tissue to be continuously suffused by lymph-containing oral pathogens and their related toxins. So if you think about it, from here, things are drained into your lymphatic system, and it drains down to the clavicular line and eventually to the breast as well. Primary sources of oral infection, well, you can look at first, root canal teeth. Second, generally infected teeth. Sometimes they're asymptomatic, and something that's very common is apical periodontitis, so it could be a periodontal disease. Then we have symptomatically infected teeth. Then we have periodontal gum infections, inflammations, cavitational gangrenes. Then we have tonsils that may play a role in that as well. Finally, infected dental implants. And of course, toxic metals like mercury that is still in amalgam, nickel, etc. If you are looking for literature, you have here on your screen two very good books. One is by my good friend and a mentor who taught me a lot about dentistry, Dr. Douglas Cook, has been practicing for many years, and that's his book, Rescued by My Dentist. And another one is by Dr. Robert Jones, who's a researcher and who basically researched the relationship between root canals and breast cancer and found that an extremely high correlation between root canals and breast cancer. So in his study, which was a 5-year study of 300 breast cancer cases, we can see that 93% of women with breast cancer had root canals, and the other 7% had other oral pathology. So if you want to get this book by George Meaning, it's called Root Canal Cover-Up. It's been published a long time ago. I think it's quite revealing. Now, here you're looking at infrared or thermographic imaging. And as I mentioned to you before in my previous presentation, that you're looking at contralateral comparison. So if we see something on one side, we want to see the same thing on the other side. And on the side here, you have a color scale. The color scale simply represents, for instance, in this case, temperatures from 26 to 36 degrees Celsius, whereas darker colors are cooler and lighter colors are warmer. So when we see, for instance, this is probably a carotid flow. However, on this particular image, we see that this area for this in this image is way more warmer, if not hot, compared to the opposite side. So we have to ask a question: why would the left side of someone's face be warmer than the right side? I mean, this is not an experiment in yogi, and you can see how the lymphatic flow here is also most likely congested in terms of drainage. Now, this is what a panoramic X-ray looks like. You can see clearly this is a root canal. There are some cavities here, more cavities here, and that's basically how we can determine, based on thermal imaging. Then we obviously need to follow up with a dental exam, and in many cases, most likely with a panoramic view as well. In this particular case, here is a panoramic view, and here's the view from our thermal imaging. Again, look at the left side here, which correlates to the root canal in here. And this, just to kind of give you an idea of what is it that we're looking at in this particular case. So the right maxillary quadrant shows early loss of first molar, likely a sign of caries or breakdown of primary teeth. And then the left maxillary quadrant indicates likely early loss of first molar tooth. And second molar has been root canaled, which is right about here, as I mentioned before, and crowned, right? Leaving a toxic, embalmed tooth that is still full of bacteria. So I have to ask a question, which I've been taught by, as I mentioned, by Dr. Cook. How is it that a dead substance is left in a person's body? I mean, if this was anywhere else but the mouth, it probably wouldn't make any sense. Now, somehow, people still continue to to deny the reality that root canals are very, very problematic in terms of health. So, is there a connection with dental pathology and breast cancer? Well, for many years, I have to actually tell you a story. One of the speakers here, Dr. Simon Yu, came up to me years ago at a medical conference when I was presenting and talking about thermography, and he said, do you see a dental connection and breast cancer? And I said, no, I don't. And he said, why not? Well, why not? Because no one ever told me to look there. Once we had this conversation, and we've become good friends since then, I decided to image all mastectomized women and asking them if I could take an image of their face as well. So in this particular case, you can see that the right breast is already missing, or it has been mastectomized, but the right side of the face of this person, you can see that not only the maxillary sinus is involved, but everything else all down the line. If you remember that acupuncture meridian chart that I was showing you, that happens to connect to all of this as well. Now, what I mean by this is that I don't think that breast cancer in this particular case caused dental pathology in this person. I think it's the other way around. And maybe it's not the most crucial factor, but it's definitely one of the important risk indicators of a person's breast health, as well as, of course, cardiovascular health and everything else that comes to dental pathology. And this is where thermography comes in very, very kind of neatly, I should say, because it's not an X-ray. X-rays are very useful in dental practice, but it is indicative when we see inflammation, especially if we see it on one side versus the other side. And here we have, again, confirmed breast cancer case, and you can see that the lymphatic flow is also affected, not only in the right axilla, but also along the neck and going into the upper right jaw as well. Here's a case study where we did a study with a local dentist here, where we imaged quite a few people and then we sent them out for a dental examination. So again, you can see a hot spot, right lower quadrant. On dental examination, we could see that the upper right first premolar appears to be necrotic, and the bridge, which is on the lower side, also seems to be dealing with the necrotic tooth. If you look at the bottom of this root, you can see that it's necrotic as well. Here is a case study, again, where we have seen lower left, tiny little hot spot right there. And we're also looking at a dental x-ray to show that lower left, again, necrotic molar. So as a risk assessment, we try and kind of look at several things. We not only look at dental issues, but we can also look at people with migraines, and in some cases, not that the migraines are visible, but we have certain patterns that would correlate to migraines or to headaches. We're also looking at the way maybe how your thyroid presents as well. In many cases, the thyroid is undiagnosed or misdiagnosed. And when we see a cold or cool hypothermia over the area of thyroid, we are suspicious that maybe the thyroid is not functioning as well as it should. In this particular case, the initial thermography was performed, as you can see, over 10 years ago. in 2010. We also established a left TMJ. In other words, the difference between upper jaw on the right side. Sorry, let me rephrase that. The upper and lower jaw connect right around here and create a lot of pressure. So a lot of people will complain that when they chew, their jaw actually clicks, or headaches or neck aches. We also find that there is a high correlation between women with TMJ and breast cancer. In this particular case, we found that the hypothermia exceeded so-called normal limit. We sent them to a dental exam. No abnormalities. However, bite splint was done. In the other issues that were picked up by a dentist, the patient actually refused any additional dental work. And in February, so maybe 6-7 months later, the same patient comes back to the dentist and telling them that she has sensitivity when she chews with lower left side. So the exam showed gingival inflammation and furcation, involvement of a 7mm pocket. Finally, extraction was performed. As you can see, we can see that on the initial image from June of 2010. Were we able to kind of raise the red flag early enough? Probably in this case, we did, but for different reasons, it didn't work out for this patient because she was asymptomatic. And that sometimes becomes a little bit of a problem, because if you don't feel anything, you probably are not aware that you have an issue. But in many, many instances, when thermography shows up with a hotspot, I always insist that the patient go and get a good physical exam by their dentist. And in many cases, it's confirmed, and in some cases, it may be confirmed in 6 months or maybe a year later, because it's just too early. And I'll come back to this subject again. Now, TMJ and lymphatics. Again, remember that from the lymph nodes will descend all the way down through the neck and into the breast as well. In this particular image, if you follow my cursor, you can see that there's a hot spot here, there's a hot spot here. Whether or not things are going to develop in the breast, obviously we don't know, but to me, this is a high-risk situation. And I would definitely address the issues above here before even looking at the breast. But in this case, the nipple temperature appears to be already a little bit off compared to our normal limits, and I suspect that something is in development. We don't want to wait until someone is diagnosed with breast cancer. We want to make sure that all risk factors are looked at, and what you need to do, if this is kind of a concern for you, is sit down with your medical or healthcare professional and develop a plan of how you're going to reduce major risk factors. In this particular case, again, today I'm just talking about dental pathology and breast cancer, but we can talk about hormones and we can talk about many other issues that are involved here. So again, TMJ and breast cancer, in this case, this person's temporomandibular joint disorder happens to be, as you can see, 1.4 degrees Celsius difference, which is huge. Now, there's also possible dental involvement on the third molar, and of course, the abnormal nipple and areolar temperatures you can see in the breast here as well. If you Image the breast, as far as I'm concerned, for all women that have had breast thermography or any thermologists that are looking at this presentation. I strongly urge you to please take images of people's orofacial, in other words, because it's very important. This is an interesting case that really many years ago opened my eyes to this whole thing. This woman came to us just for breast examination and decided also to do dental cranial, as we call it. Now, when I looked at her breast initially, I noticed a hot spot in the on the right side, right around here, but I wasn't exactly sure if I should escalate. However, when I looked at her dental cranial images, I saw this hot red spot right there, which again is very, very unilateral, and that prompted me to definitely escalate with this patient, and I asked her to go do the regular workup, mammography, and everything else. Unfortunately, she was diagnosed with late stage breast cancer. So I think that it's very important that we don't just look at one part of our anatomy. Let's face it, a breast is only 20% of a woman's anatomy. There's another 80%, and naturally, that's very important as well. So I'd like to present a case study that this is a 38-year-old male. He came with complaints of sinusitis, allergies, headaches, vision problems. I remember he was telling me that he can't really drive at night because not only he gets a headache, but when he sees stoplights before him, which are bright red, he immediately gets a headache and he gets dizzy. That's how bad it was. Fatigue, sleep problems. Now, his treatment for the past 10 years is one round of antibiotics after another one, Claritin, Emovane. Now, here is his image in March of 2016. I want you to take a look specifically at this particular area here. Now, you have also signs of inflammation in both maxillary left and right sinus. Maybe even sinus as well as other issues involved here, but we're not going to get into this right now. So we sent him to a dentist who looked at all this and decided that he needs to have a root canal done, which I personally was against, but he convinced this patient to do a root canal. His symptoms subsided somewhat, but then they came back with vengeance. And so what happened, eventually he ended up pulling that tooth, and he immediately felt relief in terms of his symptoms. Now look at before and after, how one extraction in this area here changed the whole picture. Okay, and on subsequent kind of appointments, we kind of treated this patient with some homeopathic remedies, botanicals, and of course the major thing was tooth extraction as well. Now, literally maybe a month or so after that, his sinusitis much improved. His sleep was back to normal. Headaches gone. Vision normal. Fatigue gone. Now, I know what you might be thinking right now as well. You know, I'm going to start pulling out teeth and maybe it's going to make me feel better. I don't suggest that we pull teeth unless it's absolutely necessary. I also am not a big proponent, as you've noticed, of root canals or implants. because they also have issues. So the best suggestion I could make, if it comes to taking out the root canal and basically extracting that tooth, is that you let the area heal for at least a couple of months. Make sure that the surrounding tissue around that extraction is also properly scraped, because that tissue is also infected. And you let it heal, and then maybe you should consider getting a partial rather than an implant. Not as kind of well received by most people, but I can assure you, as far as your health is concerned, it is better. So here we have another bunch of images, and you can see here how not only the whole thing kind of flows down from lower jaw into the lymphatic system, but would you say that this is a dental issue or a sinus issue? Well, it all depends, because this person may have a dental issue, but their major complaint may be sinusitis and a few other things that are associated with this. So when you go and complain to your physician about sinusitis, you are treated for sinusitis, and yet unless you have a proper dental examination and thermographic imaging pointing that there is inflammation in this area, I would definitely check for dental infections as well. Here is another image again. You can see clearly that something is going on this side of this person's face versus the opposite side. So thermography could be quite useful. Again, it's non-invasive. You can image quite frequently. And you can also image before and after. So the benefits, first of all, as everyone has mentioned before, but I'll reiterate this one more time, thermography is non-invasive. It has no radiation. There is no contact. It detects inflammation, and that's very important when it comes to our talk today. And again, it's physiological or functional, right? So physiology will precede structural change. What do I mean by that? So there's going to be inflammation first, and then there's going to be or necrosis under the gum, which probably is due to some form of an infection. And then after a while, then that becomes symptomatic. But if we can see but I should say inflammation in the area, maybe we can address this issue way before it becomes symptomatic or problematic. So thermography could be used as a diagnostic aid. It's early warning system. It's, again, risk assessment, treatment monitoring, and a prognostic indicator. In conclusion, I'd like to mention that I published a study in the Journal of Ophthalmology, European Journal of Ophthalmology in 2012 about our findings of thermography and dental pathology, and we found something very, very startling. We found that in 90%, where we have raised the question, in 90% between 6 months to a year, they were confirmed by dental examination. Some people were asymptomatic, some people symptomatic. But what really kind of affected me and again opened my eyes to this whole issue is that 70% of these people were asymptomatic. In other words, if you don't feel it, there is no problem, there is no issue. And yet, there may be an issue. So, again, we obviously need more literature, we need more studies when it comes to this particular topic. thermography, as far as I'm concerned, is very useful in dental oral evaluation. And once again, I'll say this: if you image the breast, you have to image your face as well. Because as I've given an example just a few minutes ago, you may be missing something very, very important. So with that, I would like to conclude, and I want to thank you for listening to this presentation. If you'd like to get more information, please go to our website, thermographyclinic.com. And if you have any questions for me personally, I can be reached at info@thermographyclinic.com. Thank you very much.